Welcome to you all. Today we will be talking about heart attack and heart failure, or medically it is called as congestive heart failure. So whatever we will be discussing or talking as per American Heart Association or Cleveland Clinic US or Mayo Clinic US, so which will be very relevant and authentic. So many a times we will be wondering that what is a heart attack, and heart attack happens nowadays at young age also, and we will be not knowing exactly what happens. So it is basically when let us understand then what is the role of heart. Actually, heart is an pumping organ for us. The main objective or main work of heart is to pump blood so that it reaches blood reaches throughout our body. That is the main function. So when this heart fails to pump, then the heart failure happens. So we'll try to explain this heart failure through a diagram so that you can understand in a better way. So through this diagram, we'll try to understand how heart attack or heart failure or congestive heart failure happens. So this is heart is in four chamber. This is the atrium, left ventricle, then right atrium, right ventricle. So heart receives oxygenated blood through lungs to left atrium, then through bicuspid valve it comes to left ventricle. Then from there it pumps through aorta throughout the body, that oxygenated blood. And the other side through superior vena cava, inferior vena cava, throughout the body the deoxygenated blood comes into the right atrium, and through tricuspid valve it comes into the right ventricle. And from right ventricle during systole it goes to the lungs, both the lungs, through pulmonary artery. So there again get oxygenated. So like this the circulatory system works. So mainly the left ventricle duty is to pump the blood so that it reaches throughout the body. So due to various reasons, this left ventricle myocardium, there will be a problem. It loses its elasticity or its pumping capacity due to various reasons, like age is one of the reason. Then there are hypertension, diabetes, or myocardial infarction. So many other reasons are there. So in this cases, the left ventricle cannot pump blood as it is required to pump. So we often measure this pumping capacity of the left ventricle through ejection fraction. So ejection fraction 60 to 65 is normal, and it is good. Actually 40 to 45 is okay, and when it comes below 30 ejection fraction, we call it patient is progressing toward the heart failure. Hope it is clear. Now we'll be discussing of the symptoms of heart failure or heart attack. What happens when a person is going to suffer a heart attack? The shortness of breath with activity or when lying down. So it is a breathing difficulty basically. Then fatigue or weakness is the second problem, and the next is swelling in the legs, ankles, and feet is seen. Then rapid or irregular heartbeat, which is we call it as tachycardia. Then reduced ability to exercise. Then wheezing. Then a cough that does not go away, or a cough that brings up white or pink mucus with spots of blood. So little bit spot of blood is seen in the cough. Then swelling of the belly area. Then very rapid weight gain from fluid buildup. Then nausea and lack of appetite. The person will not feel hungriness or hunger to take food. Then difficulty in concentrating or decreased alertness. Then sometimes it is seen chest pain also if heart failure is caused by a heart attack. Thank you. Now let us look into the reasons. What are the major reasons due to that heart attack or heart failure or congestive heart failure happens? One of the major reason is CAD, coronary artery disease. Because of that, heart failure happens, where there will be a plaque formation or deposition of the lipid in the coronary artery. Then second reason could be the high blood pressure over a period of time. So it's a chronic symptoms. Then heart valve disease is one of the reason for heart failure or heart attack. Then inflammation of the heart muscle is also called as myocarditis. Then congenital heart disease, this is by birth only. If it is there, then there could be chances of heart attack or heart failure. Then irregular heart rhythms called arrhythmias is one of the reason. Then there will be other reasons or other disease like long term disease like diabetes, then HIV infections, then thyroid, etc. So what are the treatments available to reduce heart attack or heart failure? First and foremost is the proper medication has to be taken. Along with that, weight reduction is important to lose weight. Then exercise, and to reduce salt and sugar. Then of course managing stress is very very important. Now we'll discuss how to prevent heart attack. So there are various methods by which we can. One is diabetes. We need to control the diabetes or sugar level. Then obesity, weight gain has to reduce. That is one more reason which heart attack can cause. Then quit smoking. Smoking we have to quit because it is the major cause of the heart attack. Then alcohol has to be reduced or quit. It can cause heart attack. And then stress management is very important. Finally, we need to reduce stress, day-to-day stress, to prevent heart attack. Then proper medications.